Let's bring in Bushra Khalidi, who joins me live from Ramallah in the occupied West Bank. She's the Oxfam policy lead for the occupied Palestinian territory. And I appreciate you taking the time as well. I mean, I think we have a pretty good understanding of just how horrific the conditions are now in Gaza. When you're with an organisation like Oxfam and you're trying to make some kind of dent into that mire, what do you focus on? What's your organisation trying to do at this point?
I mean, whatever we can do in that moment of time, and this is the problem, is, so many organizations have, their expertise in specific areas. Like, for example, Oxfam works a lot on water and wastewater infrastructure, on farming and helping farmers with their crops. But because water and sanitation infrastructure has been completely decimated in Gaza, so have most of the farmland, we're having to kind of revisit how we are programming in Gaza. And now it really is just about the pure basics: water trucking, food parcels, and hygiene kits, and whatever we're able to squeeze in here and there, including mental health support in shelters, or as much as we can provide in terms of mental health support. But that's kind of what it's been looking like, and whatever is available at in the markets, for example, that we can purchase on that day. We just have to adapt because of Israel's restrictions on the humanitarian response. It's forced humanitarians to really have to always revisit its approach and how it's responding, and really had an impact on how we're able to operate and what areas we're able to reach. We have large ambitions for responding in Gaza and for providing the most basic of needs. But because of Israel's restrictions and because of the relentless bombardment, I mean, as you see, we have not stopped in the last 14 months seeing attacks on humanitarian safe zones as Israel describes them to be. But what we've been clear about is that these are not humanitarian safe zones. These are not safe in any way whatsoever, where you're finding overcrowdedness, lack of access to bathrooms, hygiene, water, and now, I mean, the absolute tragedy of looking at people quite literally drowning in their tents, and dying of cold. I mean, what world are we in where 14 months in to this war and no action, nothing from the international community in enforcing a ceasefire and really making this stop? It's enough. Palestinians in Gaza have suffered enough, really.
It might not seem the most imminent threat to people's health and safety there, but the heavy rains combined with the bitter winter cold, what kind of different problems do they create for people?
Well, we're unable to bring in proper tents because there are restrictions on the types of poles you can get and on the types of tarp and you can get and on types of materials you can enter. So it's been very difficult to enter proper tents. Most of these people are actually living in makeshift tents with pieces of tarps they found. They found cables to be able to, hook their tarps on, and many of them are even on their homes, on the demolished homes, those who have been able to return to their homes. It's cold in Palestine. It gets very cold. I'm in Ramallah right now. As you can see, I'm wearing a sweater. It's been raining. And when it rains, not like in Europe where you would find rain across the year. We have a very, very rainy season in the winter where it rains for the whole year. And flooding has always been a symptom of the rainy season in Palestine and across the territory. I mean, can you imagine sleeping in a tent and having raindrops on you and water under you? I mean, we usually put on our babies, a second layer in the winter. We always put a second layer on our children more than we're wearing. There isn't even that in Gaza. We're seeing kids barefoot in the rain, in the mud, trying to go and collect water or collect food. It means that you're in a constant kind of you're a constant threat of either being sick or, for somebody that's elderly or with disabilities or has a very, or has a compromised immune system, you can imagine the consequences.
Yeah, I mean, we're hearing about multiple threats. People think that the bombardments are the number one threat to people's lives. But when you talk about, weakened immune system, people are dying from disease, babies freezing to death from the cold. If there's like one kind of help that you could get to people in Gaza Is there one you would prioritise? Would it be food? Would it be medicine? Would it be clothing? Or is it just too many multiple threats and they're all equally dangerous?
It's all of it. It's people can't just survive on just water. They can't just survive on food. They need food, water, shelter. They need fuel so that we can have gas stoves, at least in some of the homes, working. We need firewood in Gaza. Firewood is very expensive, so that at least people can get warm in their tents or even outside their tents. They need proper tents, proper high quality tents, so that they can at least, be shielded from the rain and the cold. We have a winter that's going to last until at least the end of February, if not the beginning of March. We have another 2 months of this. And the thing is that we have no idea how many people are dying from indirect attacks of this war, or indirect kind of consequences of this war, including those that are dying from the most simple diseases that are completely preventable, completely treatable. But because, the healthcare system is completely collapsed, it can only deal with the most traumatic injuries. It's not able to deal with people that are, having the basic cold or the basic virus. And so people may die from these viruses and from these treatable diseases.
Bushra, I really appreciate you taking the time to speak to us, giving us the benefit of your expertise. Bushra Khalidi joining me from Ramallah in the occupied West Bank. She's an Oxfam policy lead for the occupied Palestinian territory.